Welcome to this week's podcast by Step Kids Nutrition, where we explore matters related to pediatric nutrition with an invited guest. My name is Professor Roseanne Meyer. I'm a specialist pediatric dietitian with almost 30 years of experience in pediatric nutrition. In each podcast episode, we will dive into the science and also practical tips behind topics related to childhood nutrition with an invited specialist. Whether you're a healthcare professional, a parent, or just interested in pediatric nutrition, you're at the right place. I'm absolutely delighted this week for our step-by-step podcast to have a different way of doing a podcast. And I have Molly Upjohn here. Molly got in touch, I think it's now a couple of months ago with me. Molly, you're a Norland nanny, and you really shared with me some of your experiences and challenges with introducing food allergens in children. And I wanted to give you the opportunity, first of all, to introduce yourself and give me maybe your journey with food allergens and foods with the children that you see.
Yes, so I am a Norland nanny and I work full-time in London, and I've kind of had a bit of a journey with working with families. Kind of the main families I've been working with recently the children have had food allergies. And for me, I think, there's a lot of clinical support for these families in the clinical space, but, there's great allergy specialists and pediatricians and nurses and dietitians that give a lot of clinical help with diagnosis and just day-to-day kind of what to eat, what to avoid, and then allergy treatments as well. But from my perspective, I've sort of seen how you kind of leave the allergy clinic and you have to kind of set that up on your own. You're kind of navigating the day-to-day and setting it up for yourself, for that child in a way that works for them and their routine. And it can be really overwhelming for parents when they get home from a clinic and they kind of have to translate all that clinical information into day-to-day life. So as a nanny, that's something that, I've really learnt a lot about, because at the start I sort of, was just kind of going with my gut, and it took a lot more headspace, I guess, to kind of navigate very complex diets.
Yeah, and that was for me also very important to learn. Of course, we often see the dietitian as this communicator between the family to interpret what the allergists have said and then to make it realistic. But I think what you've really brought, again, even if I provide recipes and ideas, it's still you at the home and the parents at the home that need to make that reality. Now, when we kind of set this up, we agreed to do a different style, because normally when I do my video podcast, I would do the interview, but you had a lot of questions for me. And so what you're going to do today is you're going to ask me questions, and then we kind of swap around, and I've got some questions for you. So why don't you shoot off and ask me questions, and I'll try to answer them as practical as possible.
Perfect. So kind of the main question is, there's a lot of talk at the moment about allergy prevention and how eating allergens early and often can help prevent, allergies developing. It'd be just great to hear from a clinical perspective how this works and where the advice comes from.
No, that's great. So it originates really from the LEAP and the EAT study, both of them. So the LEAP study was specifically focusing on peanut, and they provided a dose of 6 grams of peanut. So, about 2 teaspoons, level teaspoons are 2 grams of peanut protein, more or less. And they provided that somewhere around 4 months of age, and really showed remarkable results in bringing peanut allergy down. So in the population that are early. Whereas EAT is a study where these children were all breastfed. So as per Department of Health, exclusively breastfed. One cohort was on top of the breastfeeding, had the early introduction of all primary allergens. So those were 6 allergens. So they randomized them to have, cow's milk in the form of yogurt, peanut again, sesame in the form of tahini, fish, wheat. And so they really went and introduced them rapidly and early. For both studies, the evidence is really the strongest for early, if we say aggressive, for peanut and egg. And in particular, in the one study, so the LEAP study, we have high-risk group, so that was defined as egg allergy and atopic dermatitis. For the EAT study, they were just general population studies. So if you said to me, Rezan, which are the primary allergens that you really want to kind of get in, I would say peanut and egg, but saying that, we don't delay any of the other allergens. So that means any of the nuts and wheat and milk and those type of things. Then you have a layer which I'm sure you've been exposed to. In those children that have had, for example, an allergist appointment, it might be that they have low level of what we call sensitization. Sensitization means they've not had a nut, for example, in their diet yet, but it showed on their skin prick test or blood results that there's low grade. And in some of those, we also kind of go, look, we've got now this window, so go, go, go. So that is really the science behind it. And the science specifically from a UK's perspective, it's pretty strong.
Yeah, it's amazing, isn't it? Because it's such a difference to kind of what my parents did with me.
100%.
Crazy.
100%.
But it makes total sense, doesn't it? It's all about building up a tolerance and teaching the body that it's safe food.
And not only that, you have this window where we call it the immune plasticity. And it's literally like you've got an immune system that you can still educate and change the course that it's going. So I think that is the science behind. But, go on and let's go through your questions, because I know you wanted to also get through the practicalities of that.
So I think obviously because of the advice is quite different now to maybe 10 years ago, what would your advice be to kind of nervous parents who might feel kind of cautious about introducing lots of nuts pretty early on, and how would you introduce them safely for the first time?
Yeah. Oh, absolutely. So I think an easy answer to that is, of course, is the format that you give it to. It's either ground or it's in a nut butter. And that goes also for egg and all of the others. You give it in a format that, from an oral motor perspective, a child can manage. An interesting fact is, if you look at all of the data, the one allergen where it's really difficult to get it in is egg.
Yeah.
I don't know. We'll come to your practical experience, but egg is really difficult. And whenever I go through, let's get egg into the child's diet, it sounds disgusting, because what we're doing is we're often pureeing well-cooked egg and mixing it into fruit. But that is actually not the nut butters, but the egg is the biggest issue. Then the second aspect is, you asked, how do we give it safely? And I think here it's always the question around risk. And if I've got a child, of course, where there is no background of allergy in the family, there's no other child with allergies, the parents don't have allergies, your risk is pretty low. And for those, I would say, look, it's pretty simple. What you do is, whether it's ground up nuts or whether it's nut butter, if you introduce it over 3 days, let's start with the tip of a teaspoon, half a teaspoon, full level teaspoon, and then you repeat it. The most important thing is the repetition. And that's a lot of, exactly. A lot of times I get this, yay, introduced it.
Tick.
And then tick, stop.
Yeah.
And that is like, it's like that bee sting that comes and you don't have a bee sting again, and then you have a bee sting after a year or so, and then there's a surprise about the allergy. I think the nervousness I find more in families where there's an atopic background. Atopy means asthma, eczema, hay fever, food allergies, where there's either another child with an allergy or a parent with an allergy, or there's eczema, for example. And in those, we can't test all of the UK population, or we don't recommend it. No. But it is, if parents are really scared, it's always better to say, okay, I'm delaying it is not going to introduce tolerance. In fact, delaying is worse. Yeah. So having that kind of mindset. And if you're really worried, fine, then migrate and see an allergist and have it fully assessed. But otherwise, my tip is doing it when your child is well.
Yeah.
That is, in any case, a very important tip. Do it at morning or lunchtime, not at night before your child. Exactly. Yeah. Then the next thing is, there's a lot of times saying smear it on the skin and so on. There's no evidence for that. And in particular, for children with eczema, we know oral consumption is tolerance inducing. Skin exposure can be actually promoting allergies, because it's not at a high enough dose, and the oral route seems to be much more tolerance induction. So whilst it feels kind of going, I'm going to smear a bit on the skin and so on, it's always better to kind of go let's do it through the mouth first. And then it's absolutely fine to start with small amounts. As I said to you before, tiny amounts. But if you know the importance, you want to get to a level teaspoon, and
Mhm.
ideally we'd like to get to that at least twice a week and
Yeah.
repeat that. Unfortunately, the dose is important.
Yeah, yeah. Um, and it's keeping that up, isn't it? Because I think, yeah, like you said, one time, ticking that off, it's not going to continue that exposure.
Exactly. That's so important. And I think that's where, when we come to my questions to you about and
Yeah,
your top tips of making it practical, I think that's where it really is important. But I think if there's one message that comes across today is, if you are delaying it, isn't really not going to make it better. And I
yeah,
know we talk about having the babies there, but I also just want to anybody that's listening and saying avoiding during pregnancy is also not going
yeah,
to have a positive impact. In fact, we know that up till 2009, the advice was to avoid, and there was an exponential increase during pregnancy. So it's really the active introduction that is the key to reducing allergy and preventing allergy overall.
amazing. And in terms of, how that food is served, so, you might get it in a few times and then continue to keep it in the diet. Does it matter if it's cooked or, in terms of tahini, for example, if you were to bake it into something, does that affect
So
it?
actually, with our nuts, that's not such a big thing. An interesting fact, it's not traditional for the UK, but if you were to go for a Nigerian boiled peanut soup,
Mhm.
that peanut that was boiled would have a lower allergenicity than roasted peanuts. Now, in the UK context, and we always kind of go, what is culturally accepted? We would have
Yeah,
roasted nuts. Of course, you avoid those with salt.
yeah,
So in the peanut context, or in other nut contexts, it's nut butters, tahini. It's kind of, you want to have the tahini paste. I think the question more is, would a nut oil or a sesame oil have the same effect? The answer is the protein load, because as you can imagine, it's a fat, would not be high enough.
yeah,
So exactly. So you really want to kind of get it as the food. Then when it comes to milk and egg and all of those type of things. So for egg, our advice is well cooked egg. So we're
yeah,
not going to give raw egg in any case for children. Once you've got your cooked egg in, as you know, the line stamped egg within the UK setting, once the cooked egg is tolerated, then you can kind of go to the more loosely cooked, but only with the line stamped eggs, with none of the others. Within milk, there is also a similar difference between cooked and raw and baked and cooked and so on. What we normally suggest is that if it comes from allergy prevention, you give it in the format that is allergenic. So, for example, you go for yogurt is a good way to start.
yeah,
That's what the EAT study has also used.
yeah,
Start with the yogurt. It's also a texture that's easy to use. It's a prerogative of the allergist or the dietitian when a child has a reaction already, for example, to milk.
yeah,
Then sometimes we do the milk ladder or the egg ladder. But when you're talking about prevention, we give it in a form where I get the protein load in a way that induces tolerance.
yeah. That makes total sense. Yeah, because I've actually done the milk ladder through my job, and it's incredible. The child I looked after had quite a severe reaction from milk, and he's now, after about a year and a half doing it, was completely fine with milk now. So it's just
Exactly.
amazing.
Exactly. And if you think that normal outgrowing is 3 to 4 years of age, it really, and even if a child doesn't do as well, if you have baked egg in a child's diet, it improves quality of life. But um, what we didn't do is we didn't talk. I mean, fish, you give us fish. Fish, you would not give raw fish in any case for a child. A wheat, you're not going to give raw flour. So, those are pretty simple, that they are cooked already and you give them in the format. I think it's just when you think about egg and milk, so you'd go to a way that a child would have it normally within diet that's also safe. And I think milk also, just to reinforce, I know for you as a trained nanny that would never come into question, but we don't go for unpasteurized milk. It's
And
really
cheese.
always pasteurized, and cheese, exactly. So you go for the pasteurization at least until the age of 1.
Yeah, yeah, perfect. And then my other question for you, here we go. Yeah, so often children get to an age where they become a bit more selective with their eating, and I obviously deal with that as a nanny. But in terms of, if there's already an allergy and then a child becomes a bit more selective with their eating on top of an allergy, potentially their diet's becoming quite restrictive. And how would you prevent sort of nutritional defects?
Yeah. And also maintain that exposure. So
Yeah.
the first thing I think that is very important is above the age of 1. So we know this neophobic phase is a normal phase that the majority of children go through. So what most parents call picky eating.
Yeah.
I'm not a big fan of the term, but it's a typical picky eater in between 1 and 4 that occurs. It mostly affects green vegetables, and that's something that we have managed throughout the hunter-gatherer time. It's a prevention towards having the bitter tasting, poisonous plants when children start walking. So that's normal.
Yeah.
I think here the most important aspect is not forceful. So I use those rules, not forceful. Find the foods that I like. Luckily for nuts, for example, because most of it is they bat the spoon away. I want to be more independent.
Yeah.
So I have a larder of recipes, and I'm sure you do, of finger foods that have nut butters or ground nuts in them. I have a lot of muffins that have no butter in them, but as butter, they have all of the different nut butters.
Perfect.
And I can get a lot in it. Or I've even got ice creams, which have got no sugar, so they just have banana, lots of nut butters. 3 teaspoons of that ice cream needs all of your nut butter. So it's finding a way of introducing. So if for any parent listening to this, if you find your child is avoiding a peanut butter,
Yeah.
then it's trying to figure out where can I bring it in. And I'm sure it's the same for you. I do pestos with nuts in them. Pasta sauces with nuts work really well. Stews, oh my goodness, delicious with a variety of nut butters in them. Then using and replacing some of the flour. If you do pancakes, replacing a third of the flour with almond flour, hazelnut flour. You can get most of the flour, the nuts now in flour, or you can kind of whiz it up at home. So I would normally work from the principle that your child is going to refuse that spoon, wanting to be more independent. And so from the start, kind of work with that and have specific ways of dealing with it. But the most important thing is never to have it forceful.
Yeah.
That never works. I'm sure that's what you see.
Fun and enjoyable. If meal times are stressful, it can be quite for everyone.
I think, Molly, it was not part of the questions that you and me had hypothesized, but I think one question, and I don't know if you've seen that as well, is when a child has got eczema on their hands.
Mm-hmm.
So then it becomes quite a tricky thing to say, look, give it orally, but, don't ideally smear it on the hands. But the child has become now very resistant to a spoon that's given. So in those type of children, we kind of, a lot of times I work with biscuits that are drier, so that it's not kind of smeary if they have the oral motor skills. But we actually smear Vaseline and things like that around their head. Yes, to have a barrier cream. And it's a good thing often because you often have drool rashes. And if then an allergen comes and then become a red. So having then a barrier cream around the mouth is a nice little tip to have.
Okay, amazing. Yeah, because even I've noticed with some foods like tomatoes, they can sort of irritate the skin and it's not an allergy. I'm sure you can explain a bit more, but I think parents can panic because they can see a rash, but it's just...
100%. So there are 2 mechanisms there. So if you've got the histamine response with tomato, specifically strawberry as well, sometimes aubergine as well, but those are the primary ones. And it comes up very quickly after consuming and spots really around the mouth. And the second one is you have the dryness. Now, you can get that with apple, you can get that in particular with fruits with high acidity, that you have dryness in particular. And again, that's with a drool rash. So a good Vaseline works a treat. Yes, absolutely. To do that. And that should not withhold you. And it's really important to distinguish between what is an allergic reaction, what is a local reaction because of the characteristics of a food.
Yeah, totally. And actually, might be just worth kind of going through quickly what are the key signs of an allergic reaction for parents to be aware of, because it's important.
Absolutely. And I'm wanting to start off with anaphylaxis, because that's what parents are afraid of, to say at the outset, that's actually not that common.
Yeah.
It's not the most common presentation. I'm sure you've seen that, but
Yeah.
it's what parents are most afraid of. So the
Yeah.
most common presentations for immunoglobulin E, so that's the immediate type allergies, would be rashes, hives, and the hives so rash would be like little dots,
Mm.
hives, a little swelling you can get around. You can get, of course, swelling of the eyes, redness, rubbing of the eyes, and itchiness. A lot of times in the face, but you can get absolutely on the torso, absolutely, and wherever it touches as well.
Yeah.
So those are the more milder ones. I get then in some of them some nasal congestion. You can get absolutely acute vomiting as well on some of them. And then it's only in the more severe cases that you get what we call respiratory compromise, when you start seeing a child mouth breathing, the lips start become swelling. And those are the more serious reaction where you kind of go, as soon as there's respiratory compromise, that we moved into a more anaphylactic reaction. I do want to touch though on non-IgE mediated allergies because people forget about it.
Yeah.
So I've described now these immediate reactions. They normally occur within an hour,
Yeah.
usually within minutes. You can get the delayed reaction. And the delayed reaction, your definition is after 2 hours. And those typically affect the gastrointestinal tract. So you can have food protein-induced enterocolitis. So they have the vomiting, refluxing,
Yeah.
abdominal pain. So they have a food, a milk, no rash during the morning. They have a yogurt, and that night they pull up their legs. They have diarrhea, and they have abdominal symptoms, and worst case scenario, blood in the stool as well. So those are the more delayed reactions. And whilst everybody kind of goes, this is bad and that's the worst, I think both
Both are
IgE, exactly,
they're both uncomfortable for the child, and
exactly,
yeah, so
exactly.
take both seriously.
Apologies.
For sure. No, but it's important to kind of go through that with people because I think people are
Exactly.
looking for the immediate signs. So yeah.
So I'm just going through what we had. We talked about the selective eating. I didn't actually answer the question of how do you manage whether a child has all the nutrients in there. In
Depends on
fact,
the allergen, doesn't it?
it depends on the allergy, but you can have one allergy, a
Yeah.
peanut allergy, and an extremely selective eater on
Yeah.
top of that.
Yeah.
So the peanut allergy is almost a side distraction, and the selective eating is the primary problem.
Yeah.
And here, my first reassurance is to parents saying you're most probably doing better.
Yeah.
Because whilst on social media, you kind of go, they need to have quinoa and they need to have, all of these fancy vegetables, a lot of berries. And in many of the children, you might have two vegetables, and that might be sweet corn, that might be carrots,
Yeah.
and you might get, a red fruit in some berries in, exactly, some berries in. You have they just like chicken. They won't have anything else but chicken, and they want to have cereal, and then they might have some milk. So if you think about your kind of mealtime balance, you want kind of go and saying, okay, protein, carbohydrate, fruit or vegetables. Your fruit or vegetable helps with the absorption of the iron. Your protein, like a chicken, has got zinc and iron in them. And so it's most probably going better. But there's nothing wrong at that stage if the child is a picky eater to say, I'm going to start on the vitamin or mineral supplement. What definitely needs to happen is if weight starts dropping, then you need to
get more.
Really somebody to have input.
Yeah.
So, Molly, we're moving towards now me asking you questions,
Nice.
which I'm looking forward to. I think it's really the question of when you think about the children with allergies, how do you keep track of which allergens a child had? How do you kind of go, ooh, Monday was peanut day? Is there specific tips that you've got there?
That's pretty much kind of a huge part of my job, to be honest, is the kind of admin of all of these things. And initially I used very clear documentation to help me. So I'd have a meal plan every week where I'd tick off the allergens and I'd work out how I was going to get them into every meal. And then I'd do a nanny diary as well, where I'd write for parents kind of for their communication.
Oh, amazing.
What we had every day and what I served and how much of that food was actually eaten, because you might serve a meal and the child might not be keen and you can try again another day. And so that helped me kind of keep track of how we were doing kind of week by week. And then actually kind of as time went on, I just realised, if you, for example, get all the nuts in at breakfast every day, a small amount of the nuts in at breakfast, all of them, every single day, you're ticking all of that off, and it just takes the mental load out of it, because you're just at the same time every day you're getting them in. So we'd do like a nut sprinkle. So we'd make like a big batch of, whiz all the nuts up into like a sort of very finely
powder kind of.
And then, store it in the fridge and just sprinkle it onto every breakfast. And then you can still mix the breakfasts up, but you just know it's getting in that way. And then things like tahini, so sesame. Kind of in my head, I was like, tahini's, it goes in hummus and it goes in dips. It's a very savoury thing. But as time went on, I was like, children enjoy kind of tahini and biscuits and cakes a lot more than often in the mixed flavours. So tahini for me is just something that kind of goes in snacks. I'll make like flapjacks with tahini, and I'll make pancakes to have kind of on the go or for breakfast. And so in my head, that's kind of my way of like, I know tahini is getting in that way, I know nuts are getting in that way. And then peanut butter, it's very easy to just do on toast or mix into porridge or make curries out of it.
For almond and cashew, go in curries.
So for me, it was just about kind of creating a rotation of meals that work, and that, I know the recipes quite well now, so I keep mixing them up, and I'm always looking for new things. But I think it's about kind of getting those allergens into the regular meals that you do. Like bolognese is something families do a lot of, but I do a tofu bolognese with soy, and that's something
amazing.
It's just about thinking about allergens differently with your cooking and just getting it in.
And therefore my question to you, does it become overwhelming? What I mean by that, because for me, eating is joyful, and I try to kind of say to parents, it should be a happy occasion. Is it for you that you're kind of going, oh my gosh, the whole meal planning is not necessarily going about the joy of eating, but just about getting those allergens in?
I think initially I did find it a little bit overwhelming, because I was, there's also loads of other aspects of my job in terms of the care of the children. So meals were taking up quite a lot of my kind of planning and time in the week. But I think, after a few years of doing it, where it's just part of routine, and like those meals are kind of part of my recipe repertoire, really, that it's just like, some of the boys' favourite food is like a nice peanut curry. And so I know that that's just, I'm not sort of medicalising getting the items in. It's just...
And that's the problem, is that we medicalise something that should be joyful.
Yeah.
And you clearly have worked, it's not only, you highlighted to me from the start, you said you need a routine, so you've got a kind of schedule that you go by, and I think that's important. But I think you've already highlighted a really good top tip in terms of the mixing. So I think nuts work really well with that mixing. You can even blend your own nut butter together or buy different pots, which work really well.
Granola's great,
Absolutely.
And getting children involved in the recipes as well. Like we do a lot of baking, and so it's a fun thing. So it's not, because you can buy different products that have the allergens in, and that's a great way for some families, because it just takes out the kind of mental load. You sprinkle it on whatever you're eating. But actually teaching children, like the eldest who has allergies that I work with at the moment is 3.5, and so he loves baking, and we'll talk about this has tahini in, and it's got sesame in, and it's also probably great for the gut microbiome as well, to get in all these different nuts.
Absolutely. It's not only, I don't want to digress and go into the research, but having it in is great for the diversity, and the peanut has also been shown really from a specific Blautia, it's called, a specific probiotic that really promotes gut health. So you're absolutely right. I wanted to ask you around how you, as a carer, you asked me, how do I make sure that they're safe and so on. How do you, because, now you're talking about they've already got it, but I could imagine when you started off, it's a big responsibility that you take. So what were the steps that you took to go, I'm going to make sure that I'm giving, but that they're safe? So
I think for me that the main thing was checking labels every time. And that's something that I still do, Good. Even though we, touch wood, he hasn't had a reaction with me, but it's something I think you can relax a bit once you've done something enough times,
Yeah.
nothing's wrong, it can be easy to think, oh, like we're fine now. But actually, yes, reading labels every single time, because products will change their ingredients and not always kind of let you know. Like you have to kind of check on the ingredients. And so yeah, checking the labels every single time and sort of making decisions when we're out and about safety. So because I find it quite easy to keep everything safe in the home because I know what we have in. But it's eating out with other friends or going for a play date and someone else cooking, and things that I would do kind of with a new nanny friend, for example. Like I have a lot of different nannies that I see and we do play dates with their children, and I would often offer to bring the dish with me if we're going to their house.
Okay.
Bring the
So you
dish.
take control.
I can control it, and then it kind of takes the stress out because I don't have to change my plan when we get there if I realise something might have the allergen in.
But do you contact them beforehand saying, look, the boys have?
Yeah.
So they are fully aware of it.
They are fully aware, and I would always bring the meal the first few times, and then once I'd sort of it's sort of about communicating with them and just hearing that they understand what is involved for allergy cooking, if that makes sense. So it's kind of reading the room, and we've been to parties before where I haven't felt fully confident that the parents completely understand, because you're not going, if your child doesn't have allergies, you probably aren't going to be aware of the same risk assessments that I would be as a nanny of a child with allergies.
So you've kind of talked about play dates and kind of informing beforehand, apologies, and taking control. What about then birthday parties? How do you cope then with the birthday parties?
Because I think with birthday parties as well, you want everyone to feel included, don't you?
Yeah, absolutely.
If there's sort of food there that they can't have, and especially when they get older, they start to notice the differences more. And so with birthday parties, I often will bring a cake, like my own, because the child I look after has an egg allergy. So egg is in kind of most birthday cakes.
Yeah, you can kind of go with it that the cake will have egg in it, yes.
So I always bring like an egg-free cake, and actually we're doing OIT for egg at the moment, so I'll often bring the OIT muffin.
Very good.
Because that kills, two birds.
And because it's important for me also to know, I often say to parents and carers, phone up beforehand to where they're going for a birthday party to ask. Do you find that useful, or you find that it's not seen as, being seen as quite threatening?
I think because my main responsibility is to keep my little boy safe. Like I'm paid as a nanny to keep him happy and safe every day. And so for me, I suppose I don't feel as bad just double checking all of these things, because I think parents and nannies sort of understand, I think because I'm also not the parent, it's more, the stakes are higher if something bad were to happen, because it's not my own child in a way. It's sort of like my only job is to keep him safe. So yeah, I do always I'll message beforehand, and a couple of times just to say, when we're first invited, I'll say, yeah, like just so you're aware, we've got these allergies, and then I'll check in like maybe the day before and just say, would you like me to bring anything? Just so that they have the option if they don't feel fully comfortable. And
exactly. And I think that's a good one to do it. And often trying to figure out what are they serving, because also I think you need to make a risk assessment. Yeah. I don't think in the UK setting, it's common to have nutty stuff being served, but eggy stuff, absolutely. Yeah. Milk also, you're not eating, but milk is also, cheesy things and so on. It's everywhere.
It's everywhere. And I think egg, people don't always think, I think people often think it's like a boiled egg, but they don't always understand that like egg glaze is also a risk. Like egg glaze is still not safe for us. So sausage rolls, I'll always check, does that have egg glaze on? Or if you are making anything with egg in, how did you prepare the other food? Did you chop the fruit up away from it? Because when you're not sort of cooking for allergies, absolutely, you don't think about those things.
No, absolutely.
And yeah, I guess it's a huge part of just like food hygiene, isn't it? Like wiping surfaces, and it's what we studied a lot when I was training to be a nurse.
Yeah, but I don't think the reality of that happening in a household, especially if there are other children. And it's always the difficulty is how much can you expect somebody else to do?
Yeah.
I've had some wonderful stories, absolutely wonderful stories where other children's parties, they made them free from and so on. Yeah. But it's also that's not a given.
No, that's exactly. So to be honest, most of the time, unless I know the nanny or parent quite well and know how they cook and know that they understand, I'll just bring our own stuff. And I'll involve the child in the choice of what we bring. So it's not like, oh, this is your like sandwich that you've had a million times before. It's like, oh, what would you like to bring to the picnic for the party? It's still not ideal because he's still kind of eating something different, but at least he's involved in the decision.
No, that's good. That's really good. Molly, I'd love to continue talking to you, but I can see we've already been talking for more than half an hour. But I wanted to really I know you are running an Instagram where you kind of post your recipes and things like that, which we will make sure is also highlighted within this video podcast. But if I were to ask you, what are your top tips? I know you've kind of already given some top tips, but are there any other top tips for parents and other carers that are listening to today's podcast to, the management and ensuring early active introduction of allergens in their child's diet?
I would say to just keep the allergens in the diet and in a way that works for you and in a way that is consistent and a way that you can keep it going. So don't bother with all these kind of crazy recipes that take hours and hours to make. Just, whip up something that I do for soy is like silken tofu and mango, whip it up into a mousse and takes like 30 seconds to make. Something that's quick and something, because it's fitting that into busy family life. So if you've got recipes that are, really quick and easy and that the children like, just keep them going. It doesn't have to be super complicated. Yeah, just kind of,
Make it easy and accessible. It does not need to also be expensive. You do not need to buy something special. And I think what a lot of times forgotten is that, the nuts and the seeds are so healthy.
Yeah.
They are a great source of protein. You do not need to then, if you've got a nut butter in a meal, you do not need to think, which other kind of protein am I bringing? It's really so good. Molly, it's been amazing talking to you. I'm sure we'll talk again at some point in the future. I will make sure that for the listeners that they have your Instagram page so that they can look at all of your wonderful recipes. I know I've looked at them, and maybe we can see also what the feedback is and see what the topic is they would like us to speak about in the future with your experience. But thank you very, very much.
Yeah, thank you for having me. It's been great to chat. So yeah, speak to you soon, I'm sure.
Thank you for listening or watching this week's podcast. You can follow me on various social media platforms, which we'll share on the screen, or you can visit my website at rosannepediatricdietitian.com. You can also like this podcast on our Step by Step Kids Nutrition YouTube channel. Thank you very much.